Good morning, Larimer County, and welcome to our January 30th, 2024 Administrative Matters Meeting, which I will call to order at 9 a.m. If you would, please join us in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all very much, and once again, welcome to our Tuesday morning meeting. My name is John Kafalis, County Commissioner residing in District 1. I'm joined by my fellow commissioners, Kristen Stevens from District 2 and Jody Shattuck McNally from District 3. Across the way, we have Heather from the Clerk and Recorder's Office, our County Manager, Lorenda Volker, and Tom and Sarah from our Commissioner's Office, from our Public Affairs Office as well. With that, we'll begin with public comment. And so far, one person has signed up, and that is Cindy Burkhart. Good morning, Cindy. Come on up. I know that you know the routine. If you would be kind enough to introduce yourself, and you have about 3 minutes, please.
Cindy Buckhart. I'm the president of the Larimer County 4-H Foundation. I was very surprised and sorry to hear the comment last week of I am not going to continue this conversation in regards to the Larimer County 4-H Foundation's request to continue hosting their 65th annual bake sale as a portion of the carnival. The Larimer County 4-H Foundation was established in 1953, 71 years ago, and we are now planning the 65th annual carnival. Since the beginning years of its inception, the foundation has held a carnival and bake sale. The carnival is what the foundation bases its budget on, and so do the 26 4-H clubs in Larimer County. The foundation uses the funds to support approximately 800 youth and over 150 adult volunteers. You commented that you appreciate engagement from the public and you are listening. I question, are you really listening? Over the course of the last 4 weeks, we have expressed several times that we have the blessing of the Larimer County Health Department to host a bake sale. The Larimer County Fair has hosted bake sales, including in 2023, and yet we have received no explanation as to why the fair can have a bake sale and the Larimer County 4-H Foundation is not permitted to. One employee at the ranch is making this decision, as he clearly stated in his email of January 18th. There is a risk involved where either you buy food from a commercial store, a restaurant with a health license, or even an event catered by the ranch. Risk, as Mr. McGrath notes, is present, but the health department has assessed this risk. This is not a ranch decision. It should be that of the Larimer County Health Department, supported by you, the Larimer County Commissioners. The ranch, as stated on their website, is proudly owned by Larimer County. Owned by Larimer County means owned by the citizens of Larimer County who finance the ranch through their taxes. You, the commissioners, are elected by the citizens of Larimer County. Are you representing the citizens of Larimer County in this decision? How can a bake sale be held at the Larimer County Fair and not the 4-H Carnival? What is the difference? Are you listening? Have you talked to the voters in your districts about this? Are you representing the voters or following the wishes of one employee? Last week, you again mentioned that this waiver and discussion has been going on for 2 to 3 years, and I asked for you to show the foundation such documentation. We have yet to receive it. Is this because it does not exist? It was mentioned that Mr. Graff has reached out to me personally to meet one-on-one. As I stated last week, this was not in regards to the bake sale, and I asked for documentation showing this request to meet regarding the bake sale. Again, I have not received such documentation. You noted that going back to 2021, the commissioners made a good faith effort to work this out, and you are not going to discuss this further. If that is the case, then why am I here? There has not been an effort to work this out. The foundation has offered a compromise, and you, the commissioners, are not willing to work with the foundation. I propose an open meeting with the 4-H community, the ranch staff, and the public to hear what the public desires, bake sale or no bake sale.
Thank you. Thank you very much, Cindy. Thank you. Sarah, has anyone requested to participate in public comment via the phone?
No, Commissioner.
And so, before we close the public comment period, This is an opportunity, if there's someone here present who did not sign up already, as Cindy did, who wishes to offer public comment, this would be the opportunity. It looks like everyone is a little bit shy this morning, with some exception. Therefore, we'll close public comment and we'll move on to the next agenda item, which is approval of the minutes. And I will ask Commissioner Stevens if you would be kind enough to offer the motion, please.
Yes, Mr. Chair, I move to approve the minutes for the week of January 22nd, 2024.
Thank you. That is a proper motion. Any further discussion, colleagues? All those in favor?
Aye.
Aye. Thank you. That passes 3-0. The next agenda item is a review of the commissioner's draft schedule for next week, and we'll turn that over to Sarah.
This is the commissioner's schedule for February 5th through the 11th, 2024. On Monday, February 5th, from 10 a.m. to 12 p.m., they will convene as the Board of Social Services in the Commissioners' Conference Room on the second floor. From 12 p.m. to 1:30 p.m., there will be an elected officials lunch at the Stakeout Saloon at 152 West Mountain Avenue in Fort Collins. From 1:30 p.m. to 2:30 p.m., there will be a work session with Leslie Ellis, Director of Community Planning, Infrastructure, and Resources in the Commissioners' Conference Room on the second floor. From 3 p.m. to 6 p.m., there will be land use items with the Development Review Team. It's a hybrid meeting. In person, it'll be in the hearing room on the first floor or virtually via Zoom. On Tuesday, February 6th, from 9 a.m. to 12 p.m., there will be an Administrative Matters meeting in the hearing room on the first floor. From 1:30 p.m. to 3 p.m., there will be Administrative Direction to County Management in the Sprague Lake Conference Room on the second floor. From 3:30 p.m. to 5 p.m., Commissioner Shattuck McNally may attend the Rodeo Board meeting. It's a hybrid meeting. In person, it'll be at the ranch at 5280 Arena Circle in Loveland or virtually via Zoom. From 5:30 p.m. to 8:30 p.m., Commissioner Kafalis will attend the Parks Advisory Board meeting. It's a hybrid meeting. In person, it'll be at the Department of Natural Resources Administrative Offices at 1800 South County Road 31 in Loveland or virtually via Zoom. On Wednesday, February 7th, from 7:45 a.m. to 9 a.m., Commissioner Kafalis may attend the City of Fort Collins, Larimer County Poudre School District Liaison Committee meeting, location to be determined. From 2:30 p.m. to 3:30 p.m., commissioners will meet with the Platte River Power Authority regarding introductions, integrated resource planning update, and Platte River future projects. That'll be in the Commissioners' Conference Room on the second floor. From 6:30 p.m. to 8 p.m., Commissioner Stevens may participate in the virtual North Interstate 25 Coalition meeting. On Thursday, February 8th, from 7:30 a.m. to 10 a.m., Commissioner Stevens will attend the Fort Collins Downtown Development Authority Board meeting at the Enosphere Ventures at 320 East Vine Drive in Fort Collins. From 12 p.m. to 1:30 p.m., Commissioner Shattuck McNally may participate in the virtual Counties and Commissioners Acting Together Fiscal Reform and Natural Resources and Wildfire Committee meeting. From 3 p.m. to 4 p.m., Commissioner Stevens may participate in the virtual City of Fort Collins Urban Renewal Authority Finance Committee meeting. On Friday, February 9th, from 8:30 a.m. to 9:30 a.m., Commissioner Shattuck McNally may participate in the virtual Forest Health Council Legislative Committee meeting. From 8:30 a.m. to 2:30 p.m., Commissioner Kafalis will attend the State Board of Human Services meeting. It's a hybrid meeting. In person, it'll be at 1575 Sherman Street in Denver or virtually via Zoom. From 9 a.m. to 5 p.m., Commissioner Shattuck McNally will attend the National Association of Counties Pew Charitable Trust Disaster Resiliency Roundtable meeting in Washington, D.C. From 12 p.m. to 1:30 p.m., Commissioner Stevens may participate in the virtual Counties and Commissioners Acting Together Transportation Committee meeting. On Saturday, February 10th, from 8 a.m. to 8 p.m., Commissioners Stevens and Shattuck McNally will attend the National Association of Counties Legislative Conference in Washington, D.C. From 8:30 a.m. to 10 a.m., Commissioner Kafalis will host a community conversation for the LaPorte community. The guests will be Irene Josie, Larimer County Treasurer and Public Trustee, who will discuss property tax statements. This will be at Me Oh My Pie at 3310 West County Road 54G in LaPorte. And on Sunday, February 11th, from 8 a.m. to 8 p.m., Commissioners Stevens and Shattuck McNally will attend the National Association of Counties Legislative Conference in Washington, D.C.
Thank you, Sarah. Colleagues, do you have any questions, comments, feedback? Commissioner Stevens?
Yeah, I just have one item, Sarah, and that is the City of Fort Collins Urban Renewal Authority Finance Committee meeting on Thursday, February 8th was canceled. So I won't be at that meeting.
Thank you.
Oh, there won't be a meeting.
Thank you. Commissioner Shattuck McNally?
Thank you, Mr. Chair. Sarah, thank you for your work on this and staff for your work on this. I am going to try to attend about a half hour of the Larimer County Interagency Oversight Group meeting virtually on Thursday, February 8th. That starts at 11:30.
Thank you.
And I'm good, Sarah. So before we move on to the consent agenda, I wish to offer a bit of an apology. Typically, after public comment, we have an opportunity to respond to what we've heard. And I think what I'd like to suggest is I will follow up once again, inquire what are the roadblocks for resolving the issue that's been raised on a number of occasions. So I will speak with our county manager and speak with the ranch director just to try to once again better understand what's getting in the way of resolving this issue. Thank you. So now we go on to the consent agenda. Yes. And the consent agenda, as a reminder, is the items that are listed are typically administrative, more of a routine nature. There's no perceived controversy regarding these items. And so we typically would entertain a motion to approve them in mass. A commissioner does have the option of pulling one of these consent agenda or pulling a consent agenda or more items off, and then we would have a discussion about that particular item, and that would occur after we approve the remainder of the consent agenda. So with that in mind, let me go through this. And also, once again, as a reminder, the details of all this stuff are online. If folks want to look up the details of agreements and petitions for abatement or refund of taxes, etc. So there are 10 abatements or refund of taxes petitions, and these are for tax years 21, 22. And basically, for those who are interested, an abatement or a refund of taxes is where a property owner can file a petition if they disagree with the notice of valuation of one's property. And this has to occur within 2 years of that notice of valuation. And the individual, the property owner, has not previously protested, as we have in the process. So there are 10 of those for tax years 2021, 2022, and you'll be happy to know I'm not going to go through each of those 10. The next item on the consent agenda, or items, agreements. The first one is, American Rescue Plan Collaborative Projects Grant Subaward Amendment to the grant agreement between CARE Housing for civil construction and associated costs for a community building and affordable housing units in the Hartside Hill site. This is an amendment to the grant agreement, and this pertains to investing funds, federal dollars, to build rental apartments that are affordable, and also regarding a community building that will be part of that very unique project on the corner of Trilby and LeMay on about 9 acres that previously had been donated by Heart of the Rockies Church. So there's no dollar amount, and this is between the county and Care Housing. The second agreement, also related to the American Rescue Plan or ARPA funds. This one, Collaborative Projects Grant Subaward Amendment to the grant agreement between Larimer County and the Matthews House for operation of the youth shelter. So in both cases, funds were allocated, and these are some amendments to the grant agreements. And this is our support of a youth shelter, which will be the first of its kind to help young people experiencing homelessness. Agreement number 3, another amendment. Well, this is a different matter. Amendment 1 to the project agreement between the Board of County Commissioners of Larimer County and the Board of Governors of the Colorado State University System. This is a pass-through grant as natural resources. Our Department of Natural Resources is serving as the fiscal sponsor for Colorado State University for the Femister Bridge and Trail Project. Since the CSU was not able to apply for these funds directly, so we're serving as the pass-through. The terms of this are April 2023 to December 2024. The total dollar amount is a little bit over $1 million. The fourth agreement, development agreement for the Jones Conservation Development, file number 21-Land 4133. This is a development agreement between the commissioners and the property owners, Todd and Janet Jones. And this is having to do with a conservation development. And again, the details are available for folks. The total dollar amount here is about $7,000. Moving on from agreements, we have a letter of support. This is a letter of support for the Windsor Highway 392 Safety and Mobility Corridor Project, a RAISE grant, federal grant, transportation related. This is an application to the Federal Highway Administration, a letter of support from our engineering folks. The town of Windsor requesting grant funding through the U.S. Department of Transportation. RAISE, it's an acronym. I suppose one of my colleagues would know what that stands for. Discretionary grant program, and so we're supporting their efforts, the town of Windsor, to make Highway 392 safer should they secure the grant. Next category is miscellaneous, and we have 4 stipulations, and these are for tax year 2023 value. And a stipulation is basically an agreement between the property owner and the assessor's office and the Board of Equalization regarding an adjustment to the property value in question. It looks like that's it. What do you know? Colleagues, do either of you wish to remove one of these items from the consent agenda? Commissioner Stevens, will you tell us what that acronym stands
I'm
for?
going to, yeah, I don't wish to remove
Go
an item,
slowly,
but I
please.
will
There
tell
are a
you
lot
what
of
the
letters in there. Go slowly.
All right, so the RAISE grant is Rebuilding American Infrastructure with Sustainability and Equity. And so just wanted to highlight that these,
Please.
in support of this grant, we're writing a letter in support of this grant. We do our transportation regionally, we plan our transportation regionally, and so this is just a example of how we're working with communities across Larimer County and Weld County to make sure that our roads are safe and taken care of.
Great. Thank you very much. Commissioner, is there anything you wish to pull off the consent? Very well, then I would welcome a motion, and I believe that's Commissioner Shattuck McNally. Am I right?
Yes.
Yes.
Mr. Chair, I move to approve the consent agenda for January 30th, 2024.
Wonderful. That is a proper motion. Any further discussion? Seeing none, all those in favor?
Aye.
Aye. So we approve the consent agenda for January 30th, 2024. Next item is commissioners' guests. We don't have anyone listed, so we can move on to discussion items. There are three discussion items. The first one is a proclamation commemorating Black History Month, and I'm wondering, that was submitted by our Assistant County Manager. Lorenda, would you like to cue this up and then we'll go to the proclamation?
Certainly, thank you. So you have historically made this proclamation recognizing Black History Month as a vital, important part of our community. And that's what this is today, is recognition. February is that month. And I think the words that are contained in the proclamation are very well written and have been reviewed by our Equity, Diversity, and Inclusion Advisory Board. And so we're really proud to do this each year.
Thank you very much, Lorenda. Appreciate that. At this time, I will ask, I think it's Commissioner Stevens, if you would please read the proclamation, then we can have some discussion or offer some comments. And I imagine we have this cool little proclamation here. We'll have to take a picture or something. Commissioner Stevens, you're on.
Thank you, Mr. Chair. So this is a proclamation commemorating Black History Month in February 2024. Whereas the Larimer County Board of County Commissioners commemorates February as Black History Month, a period which honors and appreciates the rich culture, history, and contributions of Black people to this nation. And whereas Black History Month is an annual opportunity to celebrate progress, it is also a time to solemnly remember the work of those who fought for that progress and continue to march, advocate, and work until victory is won. And whereas many Black Americans have lived, toiled, and died in obscurity, never receiving the recognition those individuals deserved, and yet paved the way for future generations to succeed. And whereas Black Americans continue to serve our communities at the highest levels of business, government, and the military. And whereas Black History Month originated in 1926 when Dr. Carter G. Woodson set aside a week in February that coincided with the birthday of Frederick Douglass to recognize the heritage and achievements of Black people in the United States. And whereas Black History Month has been federally recognized by every U.S. president since 1976. And whereas the Larimer County Board of County Commissioners acknowledges that all people of the United States are the recipients of the wealth of history provided by Black culture, then now therefore be it resolved by the Larimer County Board of County Commissioners. Section 1 recognizes the importance of Black History Month as an opportunity to acknowledge the crimes and transgressions that were committed against Black Americans throughout the history of the United States. And the Larimer County Board of County Commissioners recommits to the fight for equality and opportunity for every Black person while remaining hopeful and confident about the path ahead. And Section 2 acknowledges the significance of Black History Month as an important opportunity to commemorate the tremendous contributions and legacy of all Black Americans that have shaped the history of Larimer County. And Section 3 encourages the celebration of Black History Month to provide a continuing opportunity for all people to participate in appropriate programs, ceremonies, and activities in the community to learn from the past and understand the experiences that have shaped Larimer County. And the motion, I move to approve the proclamation commemorating Black History Month for February 2024.
Thank you very much, Commissioner. Before we take action on that motion, this would be an opportunity if we would like to offer some comments, some reflections on Black History Month in February. Commissioner Shattuck McNally, is there something you'd like to share?
Thank you, Mr. Chair, and I would like to thank staff, Lori Kadrich and our EDI board for their contributions in helping us have an extra set of eyes and lenses on our proclamations. I really am grateful and thankful that we have important proclamations like this. This is not just a piece of paper for me, this is important to take a moment and recognize the importance of this rich culture and history and contributions of the Black people to our nation. And I plan, when I am in DC next month, during the Black History Month, to visit the museum again, like I always try to do. It's really a time to go back and reflect. And I have many friends who own Black-owned businesses in Larimer County. That's one of the only kind of the Black barbershop family that we had here, I think last week. And I'm just really grateful for their engagement, and they're becoming more civically engaged. And I really am grateful for their voice and contributions to our community. And I just want to end with, since it's still kind of January and we have an MLK event this week, I just want to end on a Martin Luther King quote. I refuse to accept the view that mankind is so tragically bound to the starless midnight of racism and war that the bright daybreak of peace and brotherhood can never become reality. I believe that unarmed truth and unconditional love will have the final word. Thank you.
Thank you, Commissioner. Commissioner Stevens, anything you'd like to share, please?
Yeah, I just wanted to share that, this is a time for celebration of the many contributions that Black Americans have given to our society, and also a time for reflection about the way we've treated Black people in particular in our country. And I like that our proclamation acknowledges that we can do better and that we need to do better in this space. And I will also end with a quote by Maya Angelou, wonderful American writer and poet. Won't it be wonderful when Black history and Native American history and Jewish history and all of U.S. history is taught from one book, just U.S. history? So, thank you.
Thank you, colleagues. And I'll just add, I'm grateful that we can pause and consider and reflect on the contributions that our fellow Black Americans have made to our country, to our community. I know that there are a lot of events planned in February. I think there are a number of events at Colorado State University. And I believe yesterday or maybe today there was an article in the newspaper that described all the various events and opportunities for folks to participate in. And there was a reference to the rescheduled Dr. Martin Luther King Jr. Events in Loveland this Wednesday, I believe, which is tomorrow. So I'm grateful that we can take this time to reflect, to honor our friends and neighbors. I think the thing that strikes me is that over the years, given our history, the amazing courage that folks have demonstrated. Recently, my wife and I watched the movie Harriet, story about Harriet Tubman, and I guess I didn't know all those details. And it was very compelling, the courage that she demonstrated and how she helped so many people to freedom at great risk to herself. So grateful for that. And also, looking at, images of the Arkansas Nine, and one more recently, a 7-year-old child who went to school, segregated school in Louisiana, and how she was being escorted by law enforcement. And ultimately, this 7-year-old girl just demonstrated tremendous courage. And it turns out that school year, she was the only kid in school because the white kids would not be in that classroom or in that school. And so she had one teacher, one student. I imagine she got a lot of attention, and I'm sure that helped her to move forward and to understand the complexities of our world and the injustices. So thank you all very much. At this time, we'll call the motion. Lorenda, would you like to say anything?
I'll just add that
Please.
for you all, I appreciate that proclamations are not paper. They really do stand for the things that you want to recognize and acknowledge in our community. We don't do them every week. They are not common occurrences. They are special. And I hope the community sees that as well. This is special, and the remarks you all have just provided demonstrate that this comes from your heart. It's not just something we do because it's February and it's on paper. So thank you for your commitment to the community.
Thank you. Thanks, Lorinda. So once again, we'll call the motion. We have a motion on the table to approve the proclamation. Any further discussion, colleagues? All those in favor?
Aye.
That passes 3-0. And I think we'll pause for a moment and at least take a picture of this lovely proclamation and go on from there. Nice. Our history and our current circumstances and opportunities and challenges moving forward into the future. Our next discussion item is regarding the Behavioral Health Services Department, Summit Stone Health Partners, and we're going to receive an update on the acute care facility, otherwise known as the Longview campus, and we would welcome Laura, who can introduce herself.
Good morning, Commissioners. I am Laura Walker. I serve as the Human and Economic Health Director for the county. I've also, for about the last 6 months, been serving as the Interim Director for our Behavioral Health Services Department. And so, just for a little bit of context, I think everybody in this room is familiar with the story, but for anyone who's listening, the Board of County Commissioners supported a ballot initiative in 2018 and asked the voters of Larimer County to support a 0.25 sales tax that would last for 20 years. And the purpose of that sales tax was to try to fill gaps in our behavioral health system that had become glaringly obvious and, I would say, since the pandemic have worsened for a number of our populations. And so it's with great pride that the county on December 2nd was able to open the acute care behavioral health facility at Longview. And our partners, Summit Stone Health Partners, are the operators of that new initiative in that wonderful building that's out there. And so I have asked the CEO of Summit Stone, Michael Allen, and the medical director and also the executive director of that acute care facility, Dr. Leslie Brooks, to come and share with you what's been happening in that facility for the last 50 days that we've been, 50 plus days that we've been open. So I would invite them to come up, and they have some data to share with you about the history, the short history of the building being open. And then certainly we have some time for comments and questions from the board as well.
Thank you, Laura. Welcome, friends and colleagues, and if you would be kind enough to introduce yourselves for the record and your affiliation and so on.
Yes, good morning. Thank you, Laura Walker, for introducing us. My name is Michael Allen, CEO at Summit Stone Health Partners, and couldn't be happier to come and really celebrate what we have been able to do as a community together in partnership. We have been open for 50 plus day. In fact, today is day 60. So January 30th, day 60, not that we're counting, but 60 days in, and really could not have done this without strong partners. So really want to acknowledge, first of all, the county as a huge partner and also the funder of this, and the citizens. Those of you listening, those of you in the audience, look what you've done, and listen closely to what you have done with your tax dollars. This is really amazing what has happened here so far. We also really want to celebrate UC Health as a really strong partner. We are using their electronic health record. Through them, we are have opened a pharmacy lab, and as well as purchasing and bulk purchasing at cost or lower. So we've been able to use a really strong infrastructure healthcare partner to give us a backbone to really help us manage these funds appropriately. And finally, I'd be remiss if I didn't acknowledge all the staff who really stepped up and did really strong, broad-shouldered work. We hired 180 folks last year just for this facility, and I'm so proud of what they have pulled together, and staff that we've had all along who pulled together and made this amazing. So that is my part, and I want to turn some time over to Dr. Leslie Brooks, the medical director for Summit Stone and the executive director for the Larimer County Behavioral Health Services Acute Facility at Longview.
Thank you, Michael. And I think after Leslie, no, it's all good. It's okay. I'm just offering a suggested way forward that after your presentation, I'm sure we'll have some questions or comments. We could have a bit of a dialogue.
Absolutely. Good morning, Commissioners. My name is Leslie Brooks. My titles have been shared, and it's a pleasure to be with you this morning to talk about the last 60 days of activity at the acute care facility. Just as a quick reminder, you all know this. We signed the operations contract on June 27th. We had the wonderful ribbon cutting on September 22nd. We moved in the week of September 18th, and we did nothing but tours and engagement between September and December. I think Commissioner Shattuck McNally, you have done, outside of the folks who actually work for this facility, you have done more tours perhaps than anybody else. Tours and engagement with our community. We were deliberate in attempting to engage organizations serving our most vulnerable populations, and so we held community engagements for that population as well. We took our first patients on December 2nd at 8 o'clock in the morning. And because we go hard, we opened Longview on December 2nd and transitioned to a new electronic health record for the entire organization, also on December 2nd. So it was a momentous day for us. In terms of recruitment, we were at approximately 93% at the opening of the facility and had about 115, 120. That's not FTE, that's people serving that we had hired for the facility as of December 2nd and continued to hire over the last 60 days. And just a few photos to show you on the left-hand side, on the left column, this is just represents all of the preparation that our teams did to operate services in this new facility. Our teams running codes for when people experience medical emergencies and we need emergency services or emergency intervention. Further training and engagement around some of the ways in which we manage acutely agitated patients and some of the training that was happening for our crisis prevention intervention. And just a few pictures of the many, many tours on the bottom right-hand corner, some of our law enforcement folks who came to visit us and do some tours and particularly sort of working tours. How are we going to get the folks who you might bring to us into the facility and doing some workflows and some scenarios with our first responders. On December 2nd, we had opening day ceremonies where we really sort of kicked off the work that was going to happen over that weekend. We did them on Saturday and Sunday. Even our CEO in the upper right-hand corner, Michael Allen, got into the fun. Each discipline, including the county. I don't have a picture of Mr. Cooper taking his walk on the green carpet carpet, green for mental health awareness. But he was there with us at 6 a.m. on December 2nd. Each discipline had a walk-up song, and so we just took some time to really celebrate the momentous occasion that this was, and it provided an incredible amount of energy for the days ahead. So, how did we do? On December 2nd, our initial services focused on urgent care. We had 10 exam rooms and assessment rooms for doing that work. 23-hour observation. We opened with 4 recliners. We have a capacity for 8, but we opened with 4. Withdrawal management and crisis stabilization beds. These are actual beds where people can spend the night with us. We have 64 as you well know in the facility, but we opened with capacity for 16 of those beds, and we then opened on January 3rd an additional 8 beds, when we are now operating with a total of 24 beds for folks to spend the night with us, for either withdrawal management or crisis stabilization. Regardless of how people present to the facility, whether they're brought by law enforcement, our mobile response units, or co-response, all persons are seen through the urgent care, just to give you a little context for the numbers that you're about to see. So everyone begins with a visit in urgent care, and then clinical and medical decisions are made from there. Within the first 36 hours of opening, we were at capacity for the beds that we were open. And what that means is that we were full. We were full. We were, as we did tours, there was lots of engagement around sort of when are we going to be full? And it's sort of split between, immediately and perhaps a few months down the road. And those who put their chips on immediately won. We were full within 36 hours of opening for the beds that we had opened. And as of January 28th, for those 24 beds that we opened, we have seen 887 urgent care visits in those 58 days. Of all of those urgent care visits, of all of the 887, 76% of those folks walked through the front door of our facility. On the first day of December 2nd, on opening day, the first person to walk into the acute care facility walked up to the front desk and said, our front desk person said, "How can I help you?" And that person said, "I'm here to get sober." And our front desk person said, "Well, we can help you with that." And we've had many, many more engagements like that, and lots of feedback from folks feeling like they really were treated well, and they got the services that they need close to home. So again, 76% walked through the front door. 40% of those 887 were admitted to one of our units. And again, just a reminder, we have 23-hour observation, we have crisis stabilization, and we have withdrawal management. And it really breaks down to about a third. 33% we see in our 23-hour observation, 35% are admitted to one of our crisis beds, and 32% admitted to one of our withdrawal management beds. I've got some numbers for you that I don't have on the slide in terms of gender and age breakdown. 43% are female identifying, 57% are male identifying. So a few more males than male identifying folks than we have women. And in terms of an age breakdown, 71 people, about 8%, were under 17 years of age and under. Of those 71 folks, 6 of them were under 10, which is about 1%, little less than 1%. But 8% were 17 or under, 90% were 18 to 65. And 2%, about 20, were 65 or 66 or older. So that's just some age breakdown, and I'll update these slides and send them to Laura so you have all that data. Because we went live on a new electronic health record, some of the ways in which we collect data we are still learning and still figuring out. So it took this data is largely tabulated manually, not on paper and pen, but just through some systems in Epic that aren't as smooth as they will be here soon. Again, 76% walked through the front door. So in terms of folks who came not through the front door, this is some information about how they came to us. 15% were brought to our facility through mobile response. 5% brought by co-responders. 2% brought by law enforcement, and 3% brought by ambulance or hospital transfer. And just a quick note: those numbers are probably the numbers around law enforcement and ambulance and hospital transfer are artificially low, and it's because we really tried to focus on, after that first weekend where so many folks were actually walking through the front door. We really said we'd like to focus our energies right now on the folks who are walking through the front door, and focus on the learning and transition that needs to happen for team members who went from a 7,000 square foot building to a 50,000 square foot building. So we said to our law enforcement, please hold off on bringing folks to us, and please hold off, as well as please, the folks who you want to bring to us, please use your co-responders to do so. And so that's what they've been doing. And we've really said we've been in regular contact with our hospital partners to sort of have a dialogue about what beds we have open and what beds we don't, and really asking them if they could focus on transfer to other facilities. Here soon we will open more beds and have the ability to open that valve more. But just so you're aware, we expect that these law enforcement and ambulance numbers will get bigger as we move forward, and they're low because of the requests that we have made for them. What's next? In terms of program evolution, we are paying close attention to documentation and revenue generation. Again, we went live with a new electronic health record, and so needing to pay attention to, the new ways that we are documenting that we didn't before, and making sure that document results in a ticket that can be submitted to an insurer and then reimbursed. So those are some of the troubleshooting that you have to do when you start a new electronic health record. But again, keeping a close eye on revenue generation so that we can make sure that we are getting reimbursed for as many of these services as is possible. And with that, monitoring the need for expansion. Our future plans, as you know, include seeking national accreditation through CARF, and I cannot remember what that stands for at the moment. I will look that up and let you know. Methadone services, we committed to offering all 3 forms of medications to treat opioid use disorder in this facility. We already have some methadone services. We'll evolve those here over the next year, and then we have 2 more units. We have 32 more beds and a few more recliners that we could open on the north side of the building. 16 beds that we initially planned for residential substance use treatment, and 16 beds for additional crisis or withdrawal management beds. And we are really thinking hard about what needs in our community make the most sense for those beds. Geriatric. The question on everyone's lips is our adolescents. So really thinking about what needs we can fill with those additional beds. On the right of this last slide is some of our patient artwork, and it forms the thank you card that we give every person as they leave our services. And with that, I will say thank you and happy to answer any questions you might have.
Well done, Dr. Brooks and Michael. Thank you kindly. We'll start with Commissioner Shaddock McNally, who has her hand up, and see what questions, comments, observations you wish to make. And then we'll go to Commissioner Stevens, and I have a list of about half a dozen questions.
Thank you, Mr. Chair. First, Dr. Brooks, thank you so much for your professionalism, your expertise, and just being an amazing person. And we're so lucky to have you here in our community. Mr. Allen, just appreciate your passion and your energy and sharing, some of your story and just the partnership we have. The CARF is Commission on Accreditation of Rehabilitation Facilities.
Thank you so
And
much.
I happen to know that because I was looking at, I thought, well, that'd be cool to have. So, and I just want to say, stunning numbers Even the first weekend, I've been kind of, as you know, monitoring. And I think this is just a testament to the need that we knew was there. My first question is, you mentioned people, the slides mentioned who was seeking crisis versus medically assisted. Are there any co-occurring? Some of those are co-occurring, and is there an overlap there? So you couldn't really, or you just kind of, which is the bigger need? And I'm just wondering if there's some co-occurring category, since we know this is probably the only facility in the area, if not the United States, that has all this together. Just want to make sure our public know how unique and special and outstanding this facility is.
Absolutely. The many of these folks, in fact, probably the majority of the folks who were admitted to our care have co-occurring issues. Part of the challenge with co-occurring is the way that you have to sort of bucket people in order to put them into one of these beds. If we had our druthers, we would have one bed. We would have one bed because we believe that these conditions occur in the same brain. They run on the same neurons, and brains and families don't decide whether substance use is primary or mental illness is primary. They so frequently co-occur. So yes. The majority of these folks have co-occurring issues.
Thank you. My next question, real quick. I really appreciate the breakdowns that you gave for the first, the 43%, 57%. That's for the first 60 days, correct?
Of the gender and
yeah, the
yes,
age.
Yep.
And so I'm curious. Are you? And maybe you haven't, but I have been asked this question by some constituents about tracking how many veterans. Have you been looking at numbers? Do we have any numbers of ideas of veterans?
Absolutely. That is part of our baseline demographic data that we have collected in the past, and we will do so in EPIC. And again, some of those analytics mechanisms in EPIC, we're just getting used to. So we will absolutely have that data.
That would be great. My next question is, and I'm sorry I have so many questions, but I live and breathe this. I feel like I'm just so excited. I can't tell you how excited I am. Because of kind of the number of beds opened and kind of limiting, I think it was actually just only certain co-responders coming in at first to bring folks into the facility. And as we expand that, do you feel, because we can't just kind of open up, the whole thing and just bring the floods. Do you think anyone we have not been able to serve because we have been kind of opening slowly? Is there anyone? It sounds like you're serving everyone, no matter what. And I'm wondering, do you feel that it sounds like things were staffed adequately? You're able to do that, but I'm wondering, are we able? Is it with the co-response or others? Are they now taking into the ER because we only had a limited? We were focusing on walk-ups and not. Does that make sense? Or the co-responders taken to the ERs like they have been for the last and stuff, or because we're focused on walk-ups? Is my question clear? Is it because their systems are still there that people are going to are probably taking to the emergency rooms or other services, but because we were focusing on the walk-ups, do you feel like that number could have been larger if we had more co-response delivering or escorting folks to our facility? Is that my question kind of clear?
Let me take a stab at
Okay.
that. I think I hear a couple of questions. One, I don't think there are any more people going to our emergency departments than there were before. I think we've with these numbers, 887 persons over the last 58-ish days, and in talking to our emergency department partners, they are feeling a little bit of this offloading from their emergency departments. So I don't think there are any more people going to the emergency departments through those mechanisms, co-response, law enforcement, ambulance, than there were before. And while those folks are probably still going to the emergency department, if that's where they were going before, some of this walk-in traffic would have gone to the emergency department had we not been open. So it is a little bit of a both and I think your other question is, are we having to turn people away? And I don't think that we're having to turn people away. However, we are assessing 887 visits. And just to give you some context, in a month at our old location at Riverside, in a month, we did about 250 to 300 evaluations. And so at 4 weeks of being open at the new facility, we far exceeded the number of folks that we see in our urgent care. And these numbers, we saw 402-ish in December and another 460 in January. Those are enormous numbers for our urgent care. And this is just people seen and evaluated in urgent care before they're even admitted. So to answer your question, are we turning people away? I don't believe that we're turning people away. However, there are probably folks that if we'd had a bed, we would have put in a bed, and our team are doing more placement than they had before. So typically placement, when someone comes into an acute care facility and needs a bed, there is a team of people who work on finding that bed for them. And that is work that we had not been doing before because the emergency department had been doing it. But now we are the front door, right? And so we are doing far more work on the side of finding that bed for folks if we don't have that bed. Does that make sense?
Yeah, that does. And I don't want to suggest, I know that we're not terminated, but I just thought,
No.
boy, one of my biggest concerns before we opened up was like, wonder if like half the county shows up after the holidays, right? I mean, because and all these things, and which that would be no one could do. But I appreciate all these numbers. I just want to commend you all and your staff. I was just there Monday in person for our Consumer Advisory Council, and just the amount of effort to put in to build your team and having that welcoming, hopeful environment and the energy, it's been palpable and exciting. And I just want to thank you all for the partnership. I think this has been tremendous work and just a tremendous start to this work together and with all of our partners. And I can't say how much it gives me such joy and peace in my heart that we're making progress in this direction. I know we have a lot more work to do, but it just gives me a lot of hope that we knew this was a need, but this just more than affirms that this was the move. So I want to just thank you all for being here today and sharing these numbers, and I just look forward to continuing and just from the bottom of my heart, thank you.
Thanks, Commissioner. Commissioner Stevens,
Yes.
questions, thoughts?
I do have a couple of questions and thoughts. First of all, thank you both for being here, and thanks for your work. And wow, that's it's remarkable that you've been able to do all that in the past few months. And so it was really nice to see the pictures of the fun that you had before you opened, because it sounds like you have a lot of work now. And so I'm glad you were able to celebrate before the opening. I guess, first of all, just thank you. Thanks for the work. And there again, as Commissioner Shattuck McNally said, it really shows that there was such a need in our community. And I think that, it's interesting that you're seeing more people than you saw on Riverside. And it goes to sort of, the tours that we did and the I don't want to call it publicity, but sort of, people see it as the place to go now. And I think that that's really great that people have that as in their sights, that they have a place to go if they're in need. One of my questions with 76% walk-in, and I don't necessarily know that was always contemplated that we would have that many walk-in. And so are we concerned about transportation? Has anybody expressed that it was hard to get there or that they had transportation issues? And what does that look like going forward? Are we having conversations with the city of Fort Collins around bus service? I'm just...
Yeah, thank you for the question, Commissioner. This one surprised us a little bit as well. We were surprised that 3/4 of the folks are finding their way there, and yet when we think about it, when we were at Riverside, they were also being dropped off or driving themselves as well. And when we thought about it, when we sort of staffed some of the cases, like how are folks showing up to us, when you're in a mental health or an addiction crisis, you're probably not going to get on a bus, right? You're probably going to get a ride from somebody, call a friend, maybe drive yourself if you're able, or even like Uber or Lyft or something like that if you have the resources. So when we think about it, it kind of makes sense. And so we still think there's a need for public transportation, but we are pleasantly surprised that so many folks are finding us. I mean, you've been there, right? It's not it's not a place where you normally consider walk in, right? But folks are finding their way there, and so far that has not been a barrier.
That's good to hear, and I think we'll, in the future, kind of, if people need to visit people there or whatever, I think that, kind of working on that transportation piece is important, but it's probably not, it sounds like it's not first priority at this point. And then just with the hiring, you're continually hiring? We'll just let folks in the community know if you have this skill set that we're probably still hiring.
So, yeah. So right now we're at 97%. We started at 93%, so we're continuing to hire. The challenge is, and 97 is great. I mean, if I was 97% hired at the rest of Summastone, I'd think that's a win. Right? So for Longview, that's a really great number. We've only been open for 60 days, and we're still having some turnover, right? Some folks are finding this is not what I signed up for, right? This is a much different population, so we're trying to find a place for them within Summastone or within the community where they can be happy. So we're going to continue that, is continuous recruiting. And also, one thing, we actually had an executive team retreat yesterday talking about retention, onboarding, and what we're calling everboarding, which is, you bring somebody on, they're onboarded, and it's not a one and done. You got to continue to recruit them throughout their career with you, right? And so we're working on how do we help people stay? And so we have some turnover. It's been light, but this is really tough work. This is one of the the tip of the spear kind of work, and so it's not for everybody. And so we're continuing, but we're at 97% right now, and really working on that retention. The challenge has also been that 3% are the most difficult to hire and are overnight shifts. So they're the least desirable shifts with some of the toughest recruit prescribers, folks like that. So we're still working on that. We've got all the shifts covered, but we're feeling pretty good where we're at. Still work to do as always.
And so because the work is so difficult, I mean, I know in areas that we have in the county where the work is really difficult, let's say community corrections or the coroner's office or some of the, sheriff's office, jail, we have a lot of peer support kind of groups. And I imagine that you being especially keyed into people's mental health needs and their need for, talking through this. Do you have those kind of programs what do those programs look like for the people who work there, so they can sort of decompress and download after maybe a difficult situation?
Absolutely. Summit Stone has this has obviously been work that we've been doing for years and years, and have always had some version. It's varied over time, of a debriefing team and an after action team to come along and support folks, obviously EAP and other avenues for that. But we have also contracted with Front Range,
Naomi?
an outfit called IOMI, as well as Front Range Peer Support. I'm going to get the acronym wrong, but they are an independent outfit that's been supported by an impact grant as well, to provide real time support for staff who are struggling. And at least once over the last 60 days, we've had one of those organizations respond to a team member at the acute care facility, and it's been fantastic. So yes, there is a need, and yes, we have employed resources for that.
And I'm not surprised that I mean, in the field that you're in, that they're very conscious of that. But just great to hear about that. And obviously, we've seen that go a long way. That the peer supports and child protection is another area where it was really difficult work. So just glad to know about that. Obviously, it goes a long way towards retaining our employees and keeping them happy. So, well, thank you. Thanks. I think Commissioner Kafalis has half a dozen questions, so I will let him go.
Thank you, commissioners. Of course, thank you for your for a job well done. A great way to start this process. Also, shout out to Laura, who has been very instrumental in her role as our Human and Economic Health Director, as well as our Interim Director for Behavioral Health Services. So, thank you for shepherding these processes and making sure as best as we can that we're crossing the T's and dotting the I's. A few questions that I have. I'll try to be succinct. There was a reference to Epic and electronic medical records and being able to access UC Health. Can you tell us a tiny bit more what that means? Other than helping with billing, what are some of the other benefits of being able to access those electronic health records, and how are we protecting confidentiality?
Yeah, thank you, Commissioner Cafalas. Appreciate that. Epic is the name of the electronic health record that UC Health uses, and that's essentially the documentation tool. Epic is the premier documentation tool. 93% of patient healthcare records in the United States are on Epic right now. So it is the number one tool. Most hospitals. And how it works is you need to be a certain size to be able to access Epic. It's expensive, it's hard to train, it's hard to get. And so how small groups like us do it is you do it with an affiliate agreement with a large hospital system. And so we actually have an affiliate agreement. Summit Stone has an affiliate agreement with UC Health to use UC Health's version of Epic. And so we pay UC Health for training. We pay UC Health for a version of Epic, and we use that. And it's been great for both of us, I think. I think you'd hear this from UC Health as well. We have learned a lot more about bed-based care, documentation, and they have learned a lot about behavioral health and how to manage patient privacy, which is different in a group like Summit Stone versus UC Health, and all protected by HIPAA, which is the Health Insurance Portability, Patient Portability and Accountability Act. Should have known that before I get in front of a microphone. And then there's 42 CFR, which is the federal statute which covers addiction patient privacy. And so really, it's been excellent. What a patient will experience is a patient portal where they can look at the notes and the documentation. There's some scheduling involved in that. It's easier to use on the provider side as well for particularly bed-based care, labs, pharmacy, ordering. Those kind of things are all seamless and really sophisticated and best in class. And so we're really pleased to be able to use this. The other piece that's really key is information sharing. So when we opened up Epic, and let's say we look at, Joe Smith we pull up Joe Smith as our client, we get to see all of Joe Smith's history in the record, not with us. So we can get a full picture of how we can best treat this person, triage, refer, medication interactions. All those things are right there at our fingertips where, it was in isolation before. And so that's a huge benefit to our patients and our providers.
Thank you, Michael. And when I went on a ride along with Fort Collins Police Services and a UC Health clinician as part of their co-responder program, I saw that the UC Health employee had access to those medical records when we went on home visits. I presume that's another benefit now that we have, that Summit Stone clinicians riding with sheriff's deputies will now have access to that information.
Yes, 100%.
Okay, thank you kindly.
Although just to be clear, our UC Health are the co-responders with Fort Collins are UC Health co-responders, and we are Summit Stone as it exists on Epic, so we can see out. Because of our privacy issues, no one else can see in. So we are working on the ways in which we work with our partners to make sure that there's a few of them who can see in, and that is in development.
Great. Moving right along, colleagues, if you'll bear with me, when I visited the facility and met with you back in December 27th, I believe it was, one of the things that it was a fascinating visit, and thank you for your being such a gracious host and a good conversation that we had. Met one of the clinicians who was supervising about 8 other folks that you've hired, people with, quote, lived experience. I wonder if you could tell us a little bit about that, because it looks like you're hiring folks that have lived through some of this stuff. Could you speak to that briefly so that we can keep moving this thing along?
I think both Michael and I are sort of, eager to talk about our peers. We have a team of, as you met, Terrell, who's our peer supervisor on the tour, during our visit in late December. He supervises about 9 FTE of peer support at the acute care facility. And those peers make all the difference in the world. As he described so eloquently for you, they lead with their lived experience. And someone, as you can imagine, you've all been in the facility, and someone, as you can imagine, who is sitting in our urgent care and perhaps ambivalent or afraid of coming into treatment, afraid of what that means, afraid of what change means to their life. Our peers have the ability to engage in a way that no other staff member is able to do, using their lived experience and their professionalism. Whether they come and get admitted or not, they make an enormous difference in the lives of our clients.
Thank you, Leslie. Yeah.
Yeah, commissioners, I would just add as well that peer supports is really a key focus area for Summit Stone throughout our whole organization. We have about 700 staff right now. We have 45 of those are peers, and that's really, I would love to have 200, to be honest. I think peers do something, there's a magic there. There is something that peers can say that nobody else can say that really cuts through. And I think peers are the secret sauce of this success. We have a peer team at Longview. We have a peer team almost embedded in every team that we have. And that's really a value of ours. But I will say just a little bragging that we have more peers than any other community mental health center in the state. Not that it's a contest, but we're winning.
Thank you, Michael. And colleagues, with your permission, may I continue with a couple more questions? Thanks. Thank you. So, how will Summit Stone, that is contracted with the county to provide services out at the facility, how will you ensure accountability and transparency? Could you speak a little bit about the two committees that have been formed? I think one deals with finance, one deals with quality assurance, perhaps. I think that's important for folks to be aware of. Could you share a little bit about that, colleagues?
Yeah. So to your point, Commissioner, thank you for that question. We have two committees. One is a quality committee, and the other is a finance committee. We have what's the word? We have structured these committees. The finance committee, I didn't bring that with me. The finance committee is made up of Summit Stone finance team members and county finance team members, as well as we've got some of our quality folks who will attend those meetings, and their job is to pay attention to the expenses and to the revenue that we're able to generate. Again, brand new electronic health record. So the first meeting of that finance committee will happen. It will meet quarterly, and the first meeting will happen in March. They haven't been scheduled yet, but as soon as they get scheduled, Laura will communicate that to all of you. And the second committee is the quality committee, and that team is made up of 5 team members, again, Summit Stone and county persons, one person from the client advisory board, and another another member from the Mental Health and Substance Use Alliance. In the community. So there are five team members with the potential to add another 2 after that group begins to meet and engage. Again, that committee will meet quarterly, and its job will be to review all of the quality metrics that are coming out of the facility, both the demographics and the admissions information that we shared with you, as well as to understand our critical incidents and complaints and things like that.
And how will that particular committee further ensure our collective commitment to consumer-directed care?
So with a direct voice to the leadership of both the county and to Summit Stone, there will be the opportunity, obviously, to make with that voice to make immediate changes based on the feedback from that group.
I'm almost to the end of my questions, so I thank you for bearing with me. on the matter of demographics, collecting different demographics, I wonder if you're considering, and if you can track geographic demographics. I think it would be helpful to know, for example, how many folks might be coming from unincorporated parts of the county. I seem to recall that one of the important criterion for selecting this location, it was supposed to be kind of central. So I'm wondering if you're looking at that. There was a reference to co-occurring. Perhaps you could explain what that is. Those of us who are not in the behavioral wealth world, behavioral healthcare world, and also will one of the demographics be that how we are serving individuals with intellectual and or developmental disabilities? How are we meeting those needs, and we'll be tracking that kind of thing?
Okay.
Okay, you want me
Thank
to?
you. Thank you for the
I'm
question.
sorry, I combined
No. That's all
questions.
right. Geographic data. We will be tracking the folks who come into our services by address and zip code to understand where folks are coming from. We really said at the beginning of our work together, we're just going to see everybody. And if it turns out that 70% of folks are coming from La Junta, then we'll have to figure that out. But we wanted to open and open our doors to everyone and just understand where that is happening. Anecdotally, I believe the vast majority of folks are coming from Larimer County.
And it'll be interesting to see if they're coming from Larimer County outside of Fort Collins, for example.
Agreed. You asked another question. There was geography.
Well, the IDD, how are we serving folks with intellectual and or developmental disabilities? And I presume, with all of the various demographics, including people experiencing homelessness, we'll do our best to track those things.
Absolutely. On our list of where folks are coming from and the social determinants of health that they are experiencing, many of those are included, and we will have those by the time our Quality Council meets in March. We will have a fuller set of a fuller picture of that demographic data as we move forward in EPIC. And I will just say we just had an engagement with UC Health and some of our state representatives around our IDD population. It is not, I want to be really clear about this, it is not an exclusionary criteria for our acute care services, meaning that your status as an individual with intellectual or developmental delay does not mean that you are excluded from being seen in our acute care services. That happens, unfortunately, in other parts of our healthcare system, but that is not the case. That is not the case in our acute care facility. And just recently, we had a young woman who has intellectual and developmental delays and has many of those resources and waivers as part of her care. And we saw her in our acute care facility and arranged for ongoing care for her. And she was a rather complex case that might have been excluded from other levels of care.
No, I wasn't assuming that you would be turning folks away. Just it's more complex. But thank you very much. My last question, I bet everyone's excited to know that. And that is, there was a reference to perhaps phase 2 of our work here at the Longview campus and figuring out about children and youth or adolescent needs for behavioral health. And my understanding is that in order to determine exactly what those needs are, there will be some type of assessment. Could someone speak to that? What would that look like, and how long will that take, and when will we have enough information to decide, how and when we might be able to address, these issues?
Yeah, thank you, Commissioner. We have, we have some information. You have some information as well? Great. I'm going to turn the mic over to Laura Walker. I was going to talk about the Community Master Plan 2.0. I think that's what probably you're going to reference as well, maybe.
A little beyond.
Yeah.
Okay, we're going to turn the time over.
Yeah. And I think we know about
Thank you.
the 2.0. So I'm just specifically, I'm curious, the assessment process that I think we're supposed to undertake to figure out if we can, how we might meet the needs of children and youth.
Yes. So while there have been a number of different studies, including our own sponsored community master plan for behavioral health 2.0 that we've presented just recently to the commissioners, a lot of other entities have been looking at this data and looking for more gaps in the behavioral health system. And where we have found that there's not enough information is quantitative data around the utilization of youth in services, particularly because so often they might go to a different part of the state or out of the state to get the services that they need. So just surveying what's being done in our community now for that age population is not a full picture of the needs. And so the feasibility study that was suggested by the CMP 2.0 Community Master Plan, we will be undertaking pulling a community group together to look at what that RFP might look like and what the scope of work should be, and endeavoring to find somebody who can come to our community and give us those numbers.
Thank you, Laura. Thank you for answering my question. Yes, Leslie, and then we'll see if there are any other comments, and then I believe we should move on to our third discussion item. Yes.
I just wanted to address your question about co-occurring. When we use the term co-occurring in behavioral health, it refers to someone who has both a mental illness and a substance use disorder. It can also refer to folks who have multiple challenges within the behavioral health sphere, to include also folks with intellectual and developmental delay, as well as criminal justice.
Great. Thank you,
involvement.
Leslie. Thank you, Michael. Thanks, Laura. Commissioner, did you have your hand up, or? Oh, I guess I've talked this topic out for a bit. Yes.
Could I just share two last things with you,
Yes,
commissioners?
and I'm hoping that that you might be able to come back quarterly or whatever you all determine is a proper time frame to give us an update. Yes, Leslie.
Two
Dr.
things.
Brooks.
I just like you, Commissioner Cafals, I want to give a special shout out to Laura
Okay.
and Ken Cooper, who have been just unbelievable partners to us. Laura is doing double duty as we see as you all seek a new behavioral health services director, but they have been invaluable partners to us. This building is it's unbelievable in its modernity, et cetera, but it's a complex building, and Ken Cooper and his team have been gracious and patient and just really compassionate about the work that we do and how the building serves us. And I want to leave you with this last story. On about day 10 of opening, we had a gentleman and his 19-year-old son come to the facility. And the gentleman brought his son in a very dysregulated state, and his son was, hitting him in the car, and they were in the middle of a tussle. And the gentleman pulled up into our parking lot. His son unfortunately tried to jump out of a moving car, and we wrangled him back into his father's car. And we directed Dad to pull into the ambulance bay and close the doors behind them. This building and this facility immediately created a level of safety that our community did not have before at our Riverside location. Through the training that our teams did, we were able to get that dysregulated kiddo into our facility. He stayed with us for a couple of days and then was transferred to a higher level of care. But I just want to leave you with that. Thank you.
Thank you very much for sharing that story, and thank you, colleagues, for your good work. I think we should extend our gratitude and thanks also to the taxpayers who approved the sales tax initiative in 2018 to generate revenue 25 cents on a $100 purchase, and that's helping pay the bills as well as putting out money into the community through our Impact Fund grant program. Thank you all very much. You folks have a great day. We'll now move on to discussion item number 3, and I believe, Laura Walker, you're back on.
Thank you, Commissioners. Again, I'm Laura Walker, the Human and Economic Health Director for the county. And this discussion item that I'm bringing today is actually on behalf of Aaliyah Rodriguez, who is a part of my staff and serves as the Housing Stability Program Manager for the county. She is on a bus down to DIA to take a plane to Hawaii with her family. So I said that was far more important and said that I would certainly cover for her with this agenda item today. So we wish her well and hope she has a wonderful trip. But this is request to have the county provide support to a community initiative that's really a need that's become obvious. And so, as you know, we support and are participants in the continuum of care of Northern Colorado, which is inclusive of Larimer and Weld counties. And that is the entity that is the funnel for all people experiencing homelessness and trying to funnel all of those needs for housing and sheltering into one place and prioritize to get people as quickly into shelter and or then into transitional housing or other types of housing in the fastest manner possible in a prioritized way. And so one of the needs that we have come to realize exists in our community is to have a strategic plan for homelessness and the mitigation of the homeless state across the entire county. So our partners in the city of Loveland have their own study of this kind and know what those gaps are and have a path forward. So do our friends at the city of Fort Collins. And then Weld County as an entire population does have their own homelessness strategy to move forward. And so what we're asking is that we use the county's process for putting out a request for proposals. Our friends at Homeward Alliance, who also serve all of Larimer County, as we know, have volunteered to come forward, and they pursued a grant from DOLA, the Department of Local Affairs at the state level, and were awarded a grant to pay for this study. What was lacking, though, is the formality that government can bring to an RFP process to make sure that it's as widely publicized as possible, to make sure that it's well vetted. And so the role that we're asking for with the project agreement that we're bringing to you today is to allow the county to be the collection point for that RFP process. And then once the committee, which is made up of people from all across the community, the selection committee for the RFP, make sure that that's handed off well to Homeward Alliance, and they then will take the project forward and pay for the work through the grant money that they received.
Thank you, Laura. Before we open it up to questions, there seems to be another person in the hearing room who may be here for this particular discussion item. Were you intending for that person to
Thank you.
speak?
I had warned Linda Nuss behind me that she may get called up during the question period. So she had not prepared any other remarks to introduce this topic. But certainly Linda Nuss, she's the Director of Operations for Homeward Alliance, and she is available to us for any specific technical questions that the board might have around this agreement and the process to get a vendor to do this work.
Great, thanks for clarifying. Colleagues, do you have any questions, comments, observations? Commissioner Stevens, anything?
No, just thank you for bringing this forward. Obviously happy to help, and this is important, important regional work that we need to do. We certainly are happy to partner with the folks from Homeward Alliance. So I'm supportive of this agreement, and happy to see it come forward. Thank you.
Thanks, Commissioner. Commissioner Shattuck McNally?
Thank you, Mr. Chair. I have a couple of questions. And first off, this is, I think, wonderful to see. And I'm so grateful for our partnership with Homeward Alliance, just such strong partners. I am curious, I think it's City of Loveland had partnered with the Butler Group, because I was on the Human Services Commission at that time. Before I became a commissioner, we did some work with the Butler Group and did a strategic assessment, and then Loveland just partnered with Homeward Alliance and has been doing some evaluation. So there's some other information out there. Will that all kind of come in together to so it's not just a siloed report, but kind of looking at some of the other group data, or will this be kind of really separate?
No, absolutely. And actually the selection committee, as well as the continuum of care, has people from all of the other entities that currently have these kinds of studies and surveys and plans in place. And so we'll make sure that a good literature review of what's already existing is done by the vendor before they then try to fill in the gaps of what's missing for the unincorporated and the other smaller municipalities in the county that don't have their own plans.
I think that's excellent to hear. I also have a curiosity. I think most people, when we talk about this, thinking of the person they see in a tent, on somewhere. And I'm also curious, are we going to try to look at the 3 school districts or even part of maybe the Windsor School District for our McKinney-Vento? Will that be taken into account, or some of the folks, families living in their vehicles, or some of those folks who are housing, maybe not completely experiencing being unhoused, but maybe housing insecure? Will that scope go to that kind of depth, or are we just kind of looking at a more visible?
I think I'm going to rely on my expert
Okay.
that came with me today to maybe address what the scope of work might look like for this RFP and how much of that information might be included.
Okay, thank you.
And Madam Expert, would you identify yourself for the record?
Yeah, I'm Linda Ness. I'm Operations Director for Homeward Alliance. So thank you for having me here today, and thanks, Laura, for inviting me for extra questions here. I think the simple answer is that I think we'll encompass everything that you mentioned, but really that's the whole point of hiring a consultant to come in, because they are going to be truly the regional experts on pulling a plan together. So we're going to rely heavily on them to get their expertise. And I believe that we will be taking a look at all the things that you mentioned for sure, and collaborating with what's already going on here. I mean, there's a lot of different separate things happening, like you mentioned, the Loveland strategic plan. So everything's going to get integrated, I feel, in these efforts. So
I assumed so, but I just wanted to kind of ask those questions to clarify, and that's heartening here. And I really do appreciate you being here today and answering my question. Thank you.
yeah, thank you very much. Appreciate it.
Linda, would you spell your last name for the benefit of our clerk and recorder?
Sure, it's NUSS.
Nuss, Linda Nuss. Great, thank you. I have 2 questions. One is, how long is this going to take? The RFP and the work of the consultant, and when will we have results so that we can learn from those results and adjust what we're doing to address homelessness in our Larimer County, Weld County, Northern Colorado?
The first year is to get the consultant hired and to work with them to develop a plan. And then the second year is to implement it. And obviously this work will continue on for
Great.
years, but
So the estimates, as I recall, that Aaliyah got from our purchasing department in the timing of the RFP, is that it's probably going to take 60 to 90 days before we would have the RFP closed out and have a selection committee ready to look at applications and make that selection. And then from there, that's kind of when this 1 year and 2 year time clock would be starting that Linda referenced, as far as the overall plan for both creation of the plan and implementation of.
Yeah, thank you both. That's very helpful. My second question and my final question, and that is, I believe right now we are supposed to be undertaking the point in time study. Is that happening in Larimer County or Northern Colorado, and how's that going?
So my understanding it's going to be happening, is it in February?
no,
The
it's
point in
happening.
time.
It's happening now in January.
Okay.
It's always January.
Oh,
yeah.
thank you.
And I believe it has, I don't know the exact dates, but I believe it's like as we speak almost.
And what is that, Linda, and why is it important, please?
The point in time count is something that happens across the United States, and it's always done at the same time every year, and it just kind of gives you a trend. It's not a real super accurate count of homelessness in any particular area, but it does show you trends, and so it is to track folks who are being sheltered and who are out living on without shelter. So, yeah.
Great. Thank you very much. Thanks both. So I believe now we can go to the motion, unless there's anything else that you all want to share. And anything else from my commissioner colleagues? And Commissioner Shattuck McNally, would you offer the motion, please?
Sure. I move to approve the project agreement between Larimer County and Homeward Alliance for county facilitation of an RFP process for hiring a consultant to create a regional strategic plan for addressing homelessness.
Oh, great. That is a proper motion indeed. Thank you. Any further discussion? All those in favor?
Aye.
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 That passes 3-0. Have a nice day.
Thanks.
Well, moving right along at 10:35 a.m., we now go to our esteemed county manager's update.
Thank you, Commissioners. What a great meeting. A lot of good things to celebrate. The county serving as a convener, collaborator. It's really great to see in so many ways. My theme for last week was very much around collaborating and working together with other partners. I meet regularly with Superintendent of the Poudre School District and Brian Kingsley, and I did meet last week and talk about ways that the county might collaborate and support what they're doing. Timnath Manager Aaron Adams and Fort Collins City Manager Kelly DiMartino and I also met to talk about how the county interacts with their towns and cities. So it's very much what the county does. I hope that that's a theme the public hears and understands because we don't operate in a vacuum. We really do work with our partners every day in many ways that I think go unseen. We also have the opportunity, and I won't talk too much about this because I know you all were there as well, but we participated in the Employee of the Month celebration yesterday, which was a great opportunity to thank outstanding county staff who really do kind of excel above and beyond. It was wonderful to reread those nominations and understand the good work that they had done. They're nominated by peers, which I think makes it all the more important and valuable. So that's a great thing that we did. We also went to the Sheriff's Office awards ceremony that they do each year, and that is the tip of the iceberg of the kind of things that the Sheriff's Office does. And there were, I bet, more than 100 people recognized for various things that they had done throughout the course of the year. Most notably, more than a dozen life-saving opportunities that they participated in, both in our open spaces, out in the community at restaurants or in the community in general, and in the jail. And so that was really heartening to hear those stories and to be able to congratulate those folks face to face. And then finally, last night, we had the opportunity to go to a tour at the Human Services Building, the highlight of which was they've invited school children from the county to do artwork and place it in places where children will be served in that building. And so they feel welcome. Their own peers have created the artwork, and certainly to celebrate the kids themselves of all ages, from elementary to high school, who did submit artwork. It was a beautiful, wonderful experience and great to interact with those children. So I'll leave it on that high note. Thank you.
Thank you, Lorinda. Any questions, comments? Then we'll move on to the commissioner activity reports. And let's see. Let's start with Commissioner Shattuck McNally.
Thank you, Mr. Chair. As always, it's an honor and privilege to work with my colleagues and the commissioner staff. We do a lot of great work every week, and it's just always such a delight, and I feel very lucky and fortunate to work along some amazing folks. I'll start back to January 23rd. I attended a kind of a private vigil, but kind of with the National Organization of Women, and it was quite a very large crowd, and we had some really great conversations about some of the efforts to do a statewide initiative. So that was interesting to listen and learn from that. On Wednesday, January 24th, I attended the North Fort Collins Business Association meeting. There was mostly a meeting, a new election of officers as a new chair, but they're also setting their update of what the kind of topics they'd like to talk to this year. There were actually questions to the Fort Collins Police Department. They wanted to. I thought the police department would be able to provide details about about the Longview building. They call it the Longview building. So I helped kind of provide some information about that. I also then came up to do the Big Thompson Watershed Health Partnership, which is a collaborative group with our Larimer County OEM, the Watershed, Larimer County Conservation District, the State Forest Service, the U.S. Forest Service, and many other folks. And we're talking about a potential operational delineation pods about some collaborative work to do fire mitigation work. And we did some talking about how we would track how they would track some of that data and what kind of standardized measurements or metrics would be used so that they can show kind of the progress. And it was really a robust meeting. And I want to thank Peaks to People and Julie Dubin and some of those who helped facilitate that information and that work. It's really important for our county. There is $22 million of work identified for fire mitigation in our county alone. At this point, there's more than that with some of the U.S. Forest Service work, but these are projects that they have identified. I went down on Thursday early to be in person for our Colorado Counties Incorporated steering meeting. I would like to share with my colleagues, I've been once again unanimously or by acclamation voted in as vice chair of the General Governance Committee. I serve with our colleague to the east from Weld County, Commissioner James, and we had a very full agenda and lots of work, as you know. I won't go into all the information. The steering committees were very robust, and we had a lot of conversations, and that kind of went in all through Thursday and Friday, and I know my colleagues were also involved with that. I testified on 2 bills on Thursday. In and out of my meetings, it was kind of unfortunate, some of the timing, but I am, through my work for the Forest Health Council, one of my ideas that came out as a legislative priority is the pilot study for the slash bill, and that has moved forward and out of committee along with another bill that I'm individually supporting, and I say that only because we haven't had a conversation about it, but I'm supporting Senator Cutter's bill as a biochar study bill. Since we have some biochar organizations and we're trying to learn more about the economics of that and how that goes forward. I testified in support of that. I also moved out of committee along with another House bill, and I won't go through all the numbers. People can contact me if they'd like to learn more. For the Live Wildfire Ready program through the state is passed through to look at some funding to keep that program statewide going forward, and we see that very actively here in Larimer County. We had a Regional Opioid Abatement Council meeting, and we're moving through on a data dashboard with partnership with the county. Hopefully the initial data dashboard on how some of the opioids is being used and some of the metrics. We're going to look to have some kind of pilot ready for the end of February for the council's use and also to help us work together with our partners to track some of the work that we're doing. And then we voted to approve a little over $600,000 in regional opioid abatement settlement money for one of our priorities, which is social connectedness and belonging. And that is going to 3 organizations to provide safe spaces, but also, since it was mentioned earlier about peer-to-peer support, all 3 of these organizations, I believe, will be having an increase in a strong support for peer-to-peer support and work that's already happening. And one of those scopes is going to be changed. It's another organization that has been supported with the impact grants to expand into Loveland and other southern parts of the county, and I appreciate their willingness to do so. We have our Open Lands Advisory Board meeting. We had an excellent presentation of from our park rangers about the programs and the work that they do, and a small grant program that the Open Lands Advisory Board has was an initial presentation that would be coming to the commissioners for final approval. Certainly, again, very geographically diversely spread out throughout the county, and a lot of work to increase inclusivity of our community and access. And so I wanted to share that. That was really exciting and great presentation. I can't say enough. I wanted also attended the Colorado Commissioners and Counties Acting Together all member meeting. I think we all were there, but that was a very robust conversation, and we continue to talk about legislation that is a priority for CCAT. We had I chaired my Colorado Forest Health Council Legislative Committee meeting that I do for the Colorado Forest Health Council. As you know, tomorrow I will be present at the annual Colorado Water Congress meeting. I'm presenting along with Colorado Department of Natural Resources, Director Dan Gibbs, and the water scientist from Denver Water. Very excited about that. And it will be also our full Forest Health Council meeting in Aurora. So I will be very busy with those activities. And so I also participate in some of the conversations with our CCI meetings. Also, the Legislative Committee, we're still continuing our conversations about biomass and some of the things that we might look to do to address that. That's a big statewide concern still. And I was very glad to join my colleagues for the Habitat for Humanity Pooter Builds dedication event. We appreciate the invitation. It was a really warm welcome, and I appreciate being invited to participate. And that was a really fun time to be with everyone. And I did do some hiking with some constituents that asked me to hike one of our open space trails together. It was a great chance to talk to them about some of the things I love about our open lands programs and our open spaces, and I appreciate the invitation. And then yesterday, I wanted to say I'm really grateful for the work session on AI. I'm really thankful that we're doing that. I also attended the Consumer Advisory Committee for the Behavioral Health Policy Council or Services. I'm the liaison for that, and it was a really great discussion. They mostly had a presentation for the 2.0 Community Master Plan, and also they voted a new chair. And I want to thank Sarah McKean from Loveland, who is now the new chair of that advisory committee. It was great to be at the Employee Month celebration. It just warms my heart. We're so fortunate to have such amazing staff, and it's great to how much they love their jobs and how they support each other and what great teams they are. And I want to just commend them all for their work. It was great to be at the Human Services reopening building celebration. Yes, I agree with you, Lorinda. It was wonderful to see those kids and the artwork there. It was very moving, and the beautiful spaces, and just thanks to Heather O'Hare and all the staff for the warm welcome and the great work they did. And for the Larimer County Sheriff's Office annual awards, thanks to Mayor Winnie Kodak from Estes and Mayor Jackie Marsh from Loveland and Andrew Basenecker from the state representative who were sat around me. It was great to sit with them. I wanted to especially call, it was just amazing work. It's really well done. Sheriff Fayan, you did a great job. Appreciate it was very clear how much you care about everybody and your staff and the community. And I wanted to just special note, since we've been talking about addiction and mental health and maybe suicide prevention today, extremely proud of our Larimer County Rangers who were also recognized last night. And I forget the senior ranger's name, but there was several times our Rangers have responded to someone who went out on the ice after trying to overdose on fentanyl and opiates and risk their life to save this person and get them services. And there's several times our Rangers have responded and saved someone's life who was in a cardiac arrest, some mental health crisis, and it was mentioned, I think, at least 3 times that Narcan had to be deployed by our staff or our sheriff's staff, and just cannot believe just the selfless dedication and service, and especially crawling out on the ice to rescue someone. I just wanted to give an extra shout out to that ranger, and also to co-responder leader Sergeant Cook for his 35 years plus with the county. So that's all I have for now, sir, and thank you for letting me share.
Thank you. Commissioner Stevens?
Yeah, I'll be brief since I spent part of last week in bed nursing a really awful cold. But then luckily through remote technology was able to attend all my meetings on Wednesday and Thursday. So just want to highlight a couple things in the non-attainment area air pollution mitigation enterprise. We finally finished figuring out our funding criteria, so that's really good. We still are hoping to get the dollars out from that committee sometime this year, but those funding criteria include not only addressing ozone concerns, but also creating transportation opportunities for disproportionately impacted communities. So I think we came up with some good funding criteria, and we will look forward to getting some of those enterprise dollars out the door this year. Then just wanted to just touch briefly on the Habitat for Humanity dedication of the homes. So there were 2 homes, 2 different families that will now have homes through Habitat for Humanity, and really just a very moving ceremony to dedicate and sort of bless the homes that for those folks. And they have to spend 200 hours working on their own homes, and then a lot of community members do so as well. So it's just really nice when community members who are struggling with housing finally have a home of their own. And so that was a wonderful celebration. And then finally, yes, just wanted to acknowledge we did give awards to our Employees of the Month for the county, and that's wonderful to acknowledge that people who go above and beyond their job duties, their listed job duties, and who bring a smile to people's faces and who make others' lives better and who create innovative ways of doing their job. But we know that those 12 people aren't the only county employees that are going above and beyond, that on a daily basis, many, many employees across the county are giving their all to give wonderful services to our community, and just want to acknowledge all Larimer County employees for the work that they do. We are grateful for your work. As Commissioner Cavalis acknowledged yesterday, you make us look good, but more than that, you really deliver quality services to our community, and some really critical services that make our community a better place. So just want to acknowledge all Larimer County employees, and especially the 12 who were honored yesterday. So that is it for me. Thank you.
Thank you, colleagues. I'll be brief as well. I'll just focus on two things that were not already mentioned. One is I did attend the Equity, Diversity, Inclusion Advisory Board meeting on Wednesday. It was nice to attend in person. And the three main topics for discussion: one was a presentation from our Chief Information Officer, Mark Pfaffinger, regarding accessibility laws, in particular as it relates to websites and some of the new state laws, and how we're doing our best to comply with those laws and make sure that folks with all different levels of ability are able to access the information. The second was an update and discussion regarding the water master plan that we are involved with. So Danielle from the consulting team gave her presentation that we've seen a few times now, and there was good discussion, good feedback from the folks about that. And then finally, there was the work plan was discussed, and they actually tried to assign people who might take the lead on certain aspects. The second thing I'd like to mention that I'm sure the remaining person in our audience will be interested to know about, and that is we had I spent a number of hours up at Red Feather Lakes on Thursday, and we had our community conversation. Our guests were the new director of the health district and the medical director, so Leanne Jolan and Dr. Paul Mayer. And the purpose was for meet and greet, and also to listen to some of the history and some of the questions, concerns regarding gaps in access to community health, physical and behavioral health. We had over 60 people, around 60 people, I would say, in attendance, which has never occurred before. It was a very lively conversation, very constructive, I thought, and I think there's a bit of momentum, and we're already taking some steps. So that was really exciting. And then there was the Red Feather Lakes PAC meeting, Planning Advisory Committee meeting, and there was discussion about the sub-area plan and also some public safety issues related to Red Feather Lakes Road and school bus stops and all the rest. I think that's all I wish to share. I appreciate when I can be at events with our colleagues and when we can split up and cover more territory where it makes sense. So with that, I don't believe we have anything else. We've accomplished our objectives this morning. So at 10:53 a.m., we are adjourned.